All right, now we're going to finish the osteology of the vertebral column by talking about some of the atypical features. So the cervical vertebrae, I'm showing you them here, top 7. C1 and C2 are atypical. The typical vertebrae don't start until C3. And there's a couple reasons why C1 and C2 are atypical. They have no actual body, and C1 doesn't really have a spinous process. C2 has a vertical projection, you can see that right there, called the dens, D-E-Ns, or odontoid. And when we rotate, a lot of the rotation of our neck, turning our head to the right and to the left, occurs at that C1 on C2. So the dens, I'll show it to you again, this dens actually forms the pivot point. And C1 rotates to the right and to the left. The majority of motion occurs there, and you got it. The articulation of C1 with C2 is a pivot joint. Rotation right, rotation left, and that dens forms the pivot point. Okay? The cervical vertebrae 1 is referred to as the atlas. Think about mythology. The head sits here, and the atlas holds up the weight of the head. And then C2 is referred to as the axis, A-X-I-S. Okay, this is the hyoid bone. I'm not going to talk about that too much this semester. All of the cervical vertebrae are atypical because you see this blood vessel, okay? The cervical vertebrae, now I'm going to come over to my desk. Cervical vertebrae are atypical because they have these extra foramen beside the body. Those are called the transverse foramen, through which the vertebral artery, so back over to the articulated skeleton, you can see those transverse foramen. If you stack the vertebrae on top of one another, they serve a bony canal. You only have 4 arteries supplying head to the 4 arteries supplying blood to the brain. You got your 2 vertebrals that are shown here that go through the cervical vertebrae on either side. And then you have your carotid arteries. Obviously, those are not shown here. So the vertebral arteries, which travel through those transverse foramen, again, there are the transverse foramen. You can see the transverse foramen on either side of the body. This is the cervical vertebrae. Here's the vertebral foramen. Form a bony canal for those vertebral arteries. But understand, any kind of pathology to the neck can affect blood flow to the brain. So a lot of times in elders, not even in elders, a lot of people, if you get dizzy when you move your neck, flexion, extension, side bending, rotation, if that reproduces dizziness, we want to check that out because that might be a contraindication to doing any kind of neck exercise or manual therapy. Right? So in other words, if movement of the neck reproduces the sensation of dizziness, we do need to check that out. Okay, so cervical vertebrae. One other factor, the spinous processes are forked. And again, you can see the forked vertebrae here. And that's for attachment of muscles. But none of the other spinous processes in the vertebral column are forked that term is called bifid. So the cervical vertebrae have a bifid spinous process. So you should be able to tell a cervical vertebrae from a thoracic or a lumbar because they have bifid or forked spinous processes, and they have these extra transverse foramen. Thoracic and lumbar do not. Notice the orientation of the superior articular processes on a diagonal. Talked about that in a former video. Now let's look at the thoracic region. Okay? Thoracic vertebrae articulate with the ribs. You can see those ribs coming in and articulating. When you get down to rib number 12, you're at thoracic number 12. And I'll show you a nice picture of the costovertebral. That's where the ribs articulate with the thoracic vertebrae. But I wanted you to see that now. Notice the articular processes are oriented in the frontal plane. Notice the spinous processes in the cervical spine, especially when you get middle to lower, start to orient towards the floor. Okay, so let's go to my desk. And here we have a thoracic vertebrae. And again, you can see the down-sloped spinous process. I have my fingers on it. You can see the frontal plane articulation of the articular processes, both inferior and then superior. And then if you look closely, look at that transverse process. It's got a facet, flat surface. Look at the body. Okay, so the body of this vertebrae here and here has little flat surfaces, and that's where the ribs are going to come in and grab onto the vertebrae. Okay? So the thoracic vertebrae are atypical because they have facets for the ribs. They have the down-sloping spinous process. They actually have a kind of small vertebral foramen. The vertebral foramen is the largest in the cervical spine. The cervical vertebrae are the smallest vertebrae, but the spinal cord, because of the brainstem, is large. So look at how large that vertebral foramen is compared to thoracic. Not quite as big. And then look how small it is in the lumbar spine. The lumbar vertebrae are the largest vertebrae. They have the smallest vertebral canal. Vertebral foramen, sorry. All right, so here we have a lumbar vertebrae. And the lumbar vertebrae have the largest bodies. They have articular processes that are oriented in the sagittal plane, and they don't have the features of the cervical. So note the spinous process is large, but it projects posteriorly, not inferiorly. And there's no facets on the transverse processes or sides of the vertebral bodies. And then there's no transverse foramen. So that's our atypical features. And obviously, the sacrum, the 5 fused vertebrae, and the coccyx, 2 to 3, those are atypical vertebrae. And again, just remember our lineup: iliac crest, L4, PSIS, S2. Might as well finish. Inferior angle, T7, spina scapula, T3. Scapula itself sits between ribs 2 and 7. All right, atypical features. On to muscles.